Hey guys, ECRG here. Today we're going to be talking about how to handle feeling overwhelmed at work. Hey guys, ECRG here. Today we're going to be talking about how to handle feeling overwhelmed at work. Now I'm sure all of you guys have had those days where you go to work, you're not feeling too well maybe, and your boss just puts a whole bunch of work on your plate. You're getting pulled in multiple different directions. And how exactly do you overcome that? How exactly do you push through that? And we're going to go over some of that today and some of the strategies. Now, feeling overwhelmed is something that probably happens to everyone in every job, but especially in clinical research, it is very easy to feel overwhelmed because most people are allocated to different studies and have to report to different managers. There's not just one manager. Obviously, you have your one line manager, as they're called, who's responsible for you and your well-being, and you may or may not be working with them on a particular project. But most people are allocated to 2, 3, 4, sometimes 5 projects, and you have different managers to report to. So they try and do a good job managing your FTE or allocation, which is how many hours a week you're going to be able to work on that project. But sometimes there's a deliverable due. There are multiple deliverables due in the same week, and it can be very, very stressful. And it can make you feel overwhelmed because people want things done immediately, and you're being pulled in so many different directions. So how do you handle that feeling and still get your work done? So I recently went through this situation, and one of the things that really helped me handle this was, so at the end of the day, I typically go home around 3:30, 4 o'clock because I get in there early. At the end of the day, go home. It sounds ridiculous, but it's just that simple. Normally, when you have a big break in the middle of the day, it allows you to decompress, do some other things, think about some other things. And that's one of the best things that I do. At the end of the day, I go home. Now, I may turn on my computer a few hours later, but having that few hour break in between is extremely beneficial. Allows you to decompress, do some other things, let a few hours go by. Maybe you work out or something, and you can log back on a little bit later and work a few more hours on the project if you need to. But making sure that you turn your work computer off, don't think about it for a little while, allows you to recharge and think about something else. So that's one of the tips that I do, is I go home and do something else for a while. And now some people may just need like 10 minutes. They may just go outside for a quick walk, and then they're able to log back on and get back to it. But one of the things I like to do is allow multiple hours to go by without me going back to work again. So go home. That's the first thing. Second thing I like to do is make sure that you're using up your PTO and taking that PTO. So we've talked a lot on this channel about PTO and the importance of taking PTO and why more people should make sure that they use it. Well, it's for times like this when you feel super overwhelmed. So use your PTO after you've done all your work and you're allowed to use the PTO. Don't be afraid to take it. In America, there's a lot of cultural pressure to not take PTO, and it really stems from the top. Are the managers taking their PTO? Are the executives taking their PTO? So don't be afraid to take that PTO. That's what it's there for. And oftentimes, if you don't use it, you're gonna lose it. So make sure that you take your PTO, and that can have a huge effect on making sure that you're not feeling overwhelmed. Sometimes when I feel overwhelmed, all it takes is a little PTO, and I feel good. I'm ready to come back and hit it. Usually, I like to take enough PTO to where I'm tired of being on PTO. That's how I know I'm ready to come back to work. So I take enough, usually a week at a time, and I'm like, okay, I'm ready to come back now. So make sure you use that PTO. And then the third thing that you need to think about when you're feeling overwhelmed is make sure that you're not being overworked. In clinical research, everyone has an FTE or an allocation to a particular study. Make sure that you're falling within the allocation. It's okay to go over a little bit from time to time, and then because obviously the work comes in flows. Sometimes there's a lot of work, sometimes there's not a lot of work. So that will come with experience. When there's a lot of work, when there's not a lot of work, and you'll just understand that over time. But if you're in one of those peaks where there's a lot of work to be done all the time, and it seems to be going on a lot longer than usual, talk to your manager about making sure that you're properly allocated to all their studies and that you have the amount of time necessary to complete the task that you've been assigned. It's very easy for the FTE to get out of whack. So revisit that and make sure that everything is good with your FTE. So those are some 3 tips I have on how to make sure that you're not feeling overwhelmed at work. This is something that comes with experience, knowing how to handle and maneuver the system and make sure that you're not feeling too overwhelmed. So don't feel too stressed out. It'll come with more practice and more experience on how to navigate. So that's it for today's video. As always, guys, comment down below if you guys have any questions on other tips. I'm sure people in the comment section will have some other tips for how they don't feel so overwhelmed at work. Would love to see your comments down below. As always, email us at eliteclinicalgroup@gmail.com for anything you guys want to talk about. Also, comment down below what other videos you'd like to see. All right, put that in the comment section. And as always, guys, like, share, subscribe this video. Take care.